Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
We know that from the CDC's recommendations, you can wait to up to 42 days after your first vaccine to get your second vaccine. There are many of you that are waiting for that. We ask that you be patient as we are trying to reorganize how we communicate with you and how you schedule that and come and get that vaccine. You may have been told another date, an earlier date, 3 weeks after your Pfizer vaccine, 4 weeks after your Moderna vaccine. Actually, while you won't have the protection of the second vaccine, it does not matter in terms of the ultimate protection that you're going to get after you've had your second vaccination. There is no lack of vaccine efficacy or vaccine effectiveness after you've had the second vaccine just because you've waited a few days longer. The CDC recommendations go up to 42 days. We know that in England, they are now asking people to wait a total of 90 days after their first vaccine before they receive their second. This does not appear to have any impact on the long-term effectiveness of the vaccine in terms of severe illness. The only thing that it does is that there is still an additional vulnerable period between the time you've received your first vaccine and your second. On the other hand, we're continuing to recommend to everyone that you continue to be vigilant even after your second vaccine, to continue to mask, to physically distance from others, as we've talked about before, in all outdoor situations where you can't maintain 6 feet of distance, and certainly in all indoor situations. We ask you continue to wear masks, wash your hands very carefully before touching your face or eating. All these things should continue to happen even after you've had the second vaccine, because there is not really strong evidence that the vaccine prevents asymptomatic infection. That means it's possible that you could still spread the virus from yourself to other people, even though you're not symptomatic. As I think Dr. Fauci has said, we're not any of us safe until all of us are safe.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.